Sexually transmitted infections, or STIs, are on the rise in the U.S., and unfortunately, a new survey finds an alarming number of Americans have dangerous misconceptions about how STIs are spread and who is at risk. Barb Consiglio has more on what you need to know to take charge of your sexual health.
Have you had any symptoms or exposures that you're aware of?
Not that I know of.
As a community advocate for sexual health, nurse practitioner Stacey Biffle-Quimba has heard every excuse for avoiding STI testing.
You know, sometimes it might just be that they are concerned and they are not ready to hear the potential result.
But getting tested is as important as ever as cases rise. Syphilis, for example, has increased a startling 80% over a 5-year span.
That is one of those things that patients either won't have symptoms or won't notice their symptoms because they kind of go away.
Effective treatments are available for most STIs, but a new national survey by the Ohio State University Wexner Medical Center reveals misconceptions about the spread of STIs could delay timely diagnoses. The survey found over a third of Americans believe STIs can only be spread through sexual intercourse, a false assumption that is especially prevalent among those under 30. It's misinformation, Dr. Jose Bazan says, can only be combated through education.
Having these conversations with our patients in a safe, non-judgmental, and really a patient-centered approach ultimately is going to be a critical tool in helping us to fight the epidemic of STIs.
It's the first step in the CDC's mantra to talk, test, treat. The next step presents another challenge, as the survey also found 1 in 5 believe you should only be tested for an STI if you're experiencing symptoms.
I think a lot of people think, you know, if I feel fine, I am fine.
But even without symptoms and even with safe sex practices, anyone who is sexually active should be routinely tested.
We should just feel as comfortable talking about sexual health topics as we do talking about blood pressure, cholesterol, and diabetes.
At the Ohio State Wexner Medical Center, I'm Barb Consiglio.